Now, for the first rib, we need initially to find out whether or not it's hypomobile. And we can do this by palpating the angle of the rib as the patient inspires and expires. So let's just swing you around again this way. And we'll drop the bed down a wee bit. So we'll palpate over the angles of the ribs, like so, and we'll get the patient to breathe in without elevating the shoulders, and she's doing that well, and breathe out. And what should happen is as she breathes in, your thumbs should come down slightly and go in slightly. So we're getting this type of movement. As she breathes out, they'll come out and up. Okay? Now, what we're looking for is for one side not to be doing that. So if she breathes in and we find that one side is moving and the other side is not, then we're going to start thinking that it's hypomobile. If we find that it's actually reversing its movement, so as she breathes in, we see the rib, instead of coming down and in, we see it actually raising up, then we think that the axis of movement has changed, and this may well be subluxed. But again, this is going to be dependent an awful lot on muscle tension and muscle tone. Again, I would suggest that you don't examine these ribs until you've sorted out the cervicothoracic region and then come to them, so you'll get a lot less false positives. But let's assume that we've done that and we've found that there's a breathing irregularity and we're thinking that it is actually hypomobile. The next thing we have to do is assess this rib's glides. And again, this has an anteromedial inferior glide and a dorsolateral glide. So we can come in this way, stabilise across the body like so, put the fleshy part of the first MCP joint on the lateral border of the angle of the rib, and then I'm simply going to push anteromedially and downwards there, and pick up the glide. To pick up the dorsolateral glide, I shall simply pronate my hand a little more, come onto the medial side of the angle of the rib now, and push this backwards and outwards to get the glide there. Okay? And from these two tests, I shall find out whether we have an arthrokinematic reduction in movement, that is, it's articularly based, or whether it's myofascially based. If it's myofascial, then again, go back into this area and make sure that you've cleared it as much as you can, and then your treatment will consist of basic stretching techniques. If this, though, is articular, we need to mobilise the joint glides.